Hello, everybody. Thank you so much for joining me today for today's CMA Showcase video. It's really exciting, actually, because I'm joined by Devi Sundar, Dr. Devi Sundar. She is an incredible lady. I've just come from reading her website. I knew of Devi's work, actually, obviously, because she joined the CMA. However, I thought, well, before I speak to Devi, I want to take a bit of a deep dive to see what this lady's been up to. And I can assure you, Devi, your website is amazing. Your background is extraordinary. You have so much skill and talent, and the way you work with people is absolutely amazing. So would you be able to just sort of introduce yourself to our audience and tell our viewers and our listeners a little bit about the work that you do?
Thank you, Jayney, and it's my pleasure to be here, and thank you for having me here today. Um, as you introduced me, I'm Dr. Devi Sundar, an integrative mind-body consultant with over 22 years of experience. I would say 23 years of experience over where I started my career basic with the respiratory physiotherapy. And then I had a keen interest in psychology, and so I went in to complete my master's in psychotherapy and counseling. And then I built up the career in respiratory practice because I was more drawn towards breath and respiratory, even at the early stages of my career. And as I'm an Indian, an Asian root, I'm also like as a regular practice of prayer and meditation and this grounding techniques, which I went into my clinical practice practically. I don't see that happening in people's lives, and very few I can spot out. And that is actually in Ayurveda, which is deep rooted pranayama, which is a life force element, and it regulated through our breath. When I'm treating people with the respiratory condition, I felt like, where is the grounding gone, and where is our practicality of teaching people? We are just actually treating the symptoms, not a root cause or the cure for the what are they going through. And so then I build up my practice looking into neuroscience, hypnotherapy, and I also developed my skills in Ayurveda and went into deep of Vedic scriptures and other things, and also the formal training of Ayurveda, what it is. And then I felt like, okay, this is something which I can actually take on board rather than in a clinical setting. I've been through NHS. I've been partly a part of my years, about 11 or 12 years in Ireland in the HSA, working in the hospital setting and in the community practice. And then I moved to England and I was a clinical lead in oxygen therapy in Northwest Lancashire. And then I moved down for a teaching academic career. And I was not fulfilled in what I'm doing because I felt like I'm being restricted by external pressure, systemic management systems to deliver what I wanted to offer. That's when 2021, my practice evolved. It initially named as Long Rehab Voyage and then relabeled as Teletherapies in 2023 around that time. And during the COVID period, as well as you can imagine, that is the period where we were locked up in COVID and other things. So an online practice delivering breath recovery for people with chronic respiratory disease at that time. And mainly my key focus and intention is to educate people and professional, where we are missing this big chunk of truth that we are not breathing right. Most of us. So as I'm talking, as you are here sitting listening to me, we are actually breathing. We never scheduled that breathing. We never earned that breathing, but still it's happening. And that particular part actually had developed into like a taken for granted because breath is a bridge which connects our mind and body. And the way we use it, we can actually become smarter in regulating our life. Life is a art, and we can regulate that art very, very naturally and disease free and inner healing. So today, when we look, the biggest problem is we all are starting to breathe shallowly, too quickly, and maintaining that constant state of anxiety in us, and which is actually responsible for low grade inflammation going in, and that slow bit of stress is building up into chronic stress. And people are actually then pointing out to their traumas and other things, which is going to trigger our mind to look into that one, look as a bigger, huge thing where we have the tools since the birth, the breath, which we can actually deal with it easily by regulating. And our director, the nervous system, which we forget. So my practice, I get more passionate when I'm talking about this. My Passion or the mission of teletherapies is to empower the younger generation and also the mid-age and the older, but mostly the younger generation, about regulating their breath and recognizing breath as a tool to regulate their pressure. Because we can see that anxiety, the Mental Health Foundation, 1 in 4 people in England having anxiety. And as I'm also more actually specialized in treating chronic respiratory group, 1 in 5 people have chronic respiratory disease. When I connect the dots, chronic respiratory disease, especially COPD, smoking is the primary cause.
Mm.
And why people go to smoking? They want to run away from the issues, what is happening in them, the trauma or whatever, the boredom. And that is actually then as a tool or the crutches they lean on to the smoking habit, which is then causing in-depth damage to their lungs, their immune system, and everything. Which knowingly, if people are consuming that, we all know that people are aware of the fact, but they are forgetting this breath as a tool which they can use instead of smoking. So, for your question, I'm actually more actually wanting to empower people, and teletherapies exist as a mission here to empower people with their breath and recognize breath as a tool to heal their disease and themselves.
That is amazing. And you've gone one step further as well, because you've written a fantastic book, Breath Beyond Illness. Can you say a little bit about that and what you can expect to find in it, and how it's going to help people, how it'll help the reader?
Sure, thank you for that opportunity. This book, Breath Beyond Illness, is published last October, end of October, and the origin of it, a little story behind it. I was actually doing my PhD at the same time, a PhD in psychology, holistic integral therapy. And my PhD is all about my publications on how and also my practical experience with people and other things around that. Especially when I focus on the people here, I'm talking about people with chronic respiratory disease, the the struggles they witnessed, the breathlessness, and I was more delivering the respiratory rehabilitation to people with chronic respiratory conditions. And we used to actually rehabilitate them, teach them exercises, and teach them and give the 1 session of education during the 8 weeks of training in the rehabilitation setting. And people actually walk more, which is one of the measure we measure at the end of the rehabilitation. And people feel good at the end of the session, 8 weeks, and most of them. Not all of them, because it depends on the stages of their condition. And but within 2 or 3 months, they actually return back to the rehab and return back to the consultation with the respiratory consultant, which we partly also assess the oxygen levels for the people. And I was actually so curious what makes them feel good at the end of the session, and then within 3 months or 4 months, then they return back to the stage 1 where they actually enter the rehab earlier. And one thing I then got to understand, and also to reading other books and publications and research, they are stuck in a fear mode because as humans, we have been designed to suspect where is danger. Our human brain is designed to protect us. We are always in a survival mode. Yeah. And when the breath has initially been gone wrong in those people have experienced, that has been registered in the brain, in the fear center. And that has been triggered again and again, a pattern where they cannot come out of the fear center. So what the rehabilitation is missing is we are treating the extremities, the limbs, and the endurance, what we call it as actually how far they can walk, but we are missed or failed to treat. Have they got off the fear? Have they developed the safety in their brain, safety center that's been strengthened to survive the daily practical life, what they're going to go out after the rehab? And that's when this book actually started. When I started to put together my PhD, okay, I need to communicate this to the public in a lay people words, and I wanted to help them to understand. It is also about people understanding themselves. The breath is actually two-way. It can be controlled voluntarily and involuntarily, and it is also connecting your emotions.
Mm.
So we forget that when we're happy, we're excited, okay, and we breathe very fast during excitement, but that doesn't affect us. But when we actually get too much stressed and panic, and that is only affecting us. So the emotional state matters here.
Mm.
So, and how the perception of their emotion is also matters. So that's where this book, Breath Beyond Illness, is all about talking to people, like especially the population with chronic lung conditions, talking to them about it is not enough that you actually focus on your rehabilitation and walking, but also understand your breathing is connected to the way you perceive how your breathing is.
Yes,
And
that's so
how
interesting. Yeah. Mm.
and how you can actually strengthen that emotional center. And also it delivers a message to the public policy makers and also the healthcare professionals that should stop treating people only with their limbs or their external measures, but start looking inside the people
Mm.
and how they're actually feeling about their breath. Because each one's perception differs. Like for some of them, their breathlessness might not be mattering that much to them. And they might be having certain other priorities or purpose in life, which they have a least perception of their breathlessness as, because it also depends on the stage. So this is a key message I'm delivering there. You need to actually focus on your breath, and breath is a tool that connects your emotion. And your lung condition is not only related to lungs, it is also related to your mind.
Mm.
So that's the key message I'm delivering in that book.
That is absolutely fantastic, Debbie. So, if people are interested in coming to see you, what are the types of ailments that people might turn up with? What are the sorts of things that you work with from time to time?
That's a good question. Thank you for that. So, because I have been working with a chronic respiratory population, so my key population group I'm looking at and delivering the integrative medicine is chronic respiratory disease. With that, mention that I'm also delivering to mental health side, people with anxiety or depression, PTSD, and workplaces where there is only a tick box exercise. It's like, okay, you go for mental health training as a first aid mental health training, but no one is actually looking at the internal measures of mental health. Yes, it's like a part of training. So we are delivering integrative workshops to the corporates to understand the key of the breath and nervous system control retraining. And my program is it's in a formative program, and it's not a one-off session. So each of the program is about 8 weeks to 9 weeks. It differs. The breath program is 8 weeks, and mental health program is 8 weeks. And the Psych Thrive is one which we offer to the workplaces, which is 9 weeks.
Mm.
So we actually assess their workplace environment, the teams, mental health and the strength, and then we actually give the report at the end as well for them. So I think that is very much needed because most of our hours are in the workplaces, and the people we work with, we needed that kind of understanding and coordination for team success as well. So yeah, that's what I do.
Fabulous. Yes, that's fantastic, Davy. And if somebody wants to find you, presumably they will go to your website. It's your obviously your you they can Google you. You're Dr. Devi Sundar, but the website is devisundar.org. Is that right? Have I understood that correctly? Yes. Good.
Yes, so that's my professional website, that's my portfolio.
Right.
And the work I do is tele-therapies.org. So that's the website. So you go to tele-therapies.org where you can find the services I offer. As
Mhm.
I was mentioning the services, I also missed mentioning about, I also offer professional training, respiratory psychology and inner calm workshops to professionals as well. And there are a couple of other the courses mentioned in my website. I also run a community nonprofit, and that's the Mind Body Synergy CIC, which I've not affiliated with the CMA, which I've not mentioned in that. So, but I also do other side of work, so just to put that side on that.
Fantastic. And you're a mum of two teenagers. So how do you find the time? That's what I want to know. Most of all, it's just, you're so busy with all the incredible things you do and the incredible number of people you look after. And running I didn't know about the side thing is also the CIC as well. How do you find the time to do all of this? It's remarkable.
Thank you for the appreciation. I do struggle, and it doesn't come without struggle. And but I have learned through my struggles to set some boundaries in my time.
Yeah.
And especially the digital boundaries. Family is after my up to 6 is my work,
Yeah,
And after 6 or the maximum 6:30, I wouldn't take any of the phone calls or anything related to the work. And even to my friends, I don't take any calls in the evening because I believe that if there is anything conversations which we don't like it, that's going to be ruminating in our mind throughout the
true.
night. So I
Yes.
never take any messages that can wait, obviously. I would leave it to the next day. Yeah, so I
Yeah.
set boundaries. And
Firm
look
boundaries.
fine.
Firm boundaries are a good thing. They really are. This is absolutely incredible. Dr. Devi, you are an amazing, amazing, inspirational woman. Thank you so much for joining us. I know that we'll be inviting you back for more in-depth sessions. Obviously, a CMA Showcase video is just to introduce you to all of our viewers and listeners. But truly, you are an exceptional person, and thank you for the healing that you put out into the world. Your work is so important, and you have such a unique take on things. And I know that you're going to be, just healing so many people with the work that you do, and that, of course, has a knock-on effect to other people as well. So, healing, for example, a mother in a family then has a knock-on effect to the rest of the family, and so on. And so it then has a knock-on effect to society as a whole. So, I do but always talk about this ripple effect that we have as practitioners. But my goodness, you truly are doing that. And we are very grateful to you here at the CMA for this spectacular work that you do. And so, yes, we can't wait to see you again. And I know our viewers and listeners will feel exactly the same. So thank you for being with me today.
Thank you very much for having me and the opportunity to share my work.
It's a pleasure. Take care. See you soon.